Let's begin by looking on the antimetabolites. The mechanism of action of these drugs is they inhibit the enzyme known as dihydrofolate reductase enzyme, which converts dihydrofolate into tetrahydrofolate, which in turn is essential for synthesis of purines and pyrimidines, which further causes the DNA synthesis in the S phase. Mind you, these drugs work on the G1 phase. So in summary, we are saying that these drugs disrupt the G1 phase in the cell cycle. Examples of drugs under this category, we have methotrexates, mercaptopurines, and cladribine, etc. Alkylating agents. These drugs act by damaging the DNA synthesis, thus interfering with cell replication. These drugs act on the S phase where there is duplication of DNA. So in summary, we are saying that these drugs inhibit that process of duplication of DNA into leading to the next stage, which is G2 phase. And some of the examples that you can find under this category, we have cyclophosphamide or cytoxin, ephosphamides, chlorambucil, for example, etc. Anti-tumor antibiotics. These drugs work on the G2 phase. In the G2 phase, if you remember very well, we said this is where there is synthesis of proteins. Now, the mechanism of action of these drugs, just in summary, they inhibit that process of protein synthesis, hence damaging the cell. And some of the examples of drugs that you can find under this category, we have doxorubicin, bleomycin, mitotic inhibitors. These drugs work on the M phase or during the mitosis of the cell. During this phase, if you remember very well, we said that this is where now the cell divides into two identical daughters and it's ready to start the process again. In summary, we are saying that in the mechanism of action, these drugs inhibit that process of cell division. So they disrupt that phase, meaning there will be cell death. Examples of drugs that you can find under this category, we have vinristin or oncovin. We also have vindaxin, we also have vinblastine, for example, etc. Let's move now to cell cycle specific drugs. We are done with cell cycle non-specific drugs. So the cell cycle specific drugs, also known as targeted therapies. This is a new approach in cancer treatment. They work by interfering with cancer cell growth and division in different ways and at various points in the developing, growth, and spread of cancer. These therapies may interfere with proteins or enzymes in cancer cells, leading to apoptosis. This type of treatment only affects tumor cells and spare normal cells, hence decreasing the associated toxicity. Cell cycle specific drugs are classified as follows: topoisomerase 1 inhibitors. Example of drug that you can find under this category is topotecan. Topoisomerase 2 inhibitors. The drug you can find under this classification is etoposide. We also have tyrosine kinase inhibitors. Example of drug that you can find under this group is gefitin. So you should note that all these drugs that I've mentioned under cell cycle specific drugs, they work on the G1 phase. That's where you find the synthesis of enzymes. Ways to use chemotherapy. Adjuvant therapy. Chemotherapy used in conjunction with another treatment modality. Neoadjuvant chemotherapy. Chemotherapy to shrink the tumor prior to surgical removal of the tumor. Primary therapy. The treatment of patients with localized cancer for which there is an alternative but less than completely effective treatment. Induction chemotherapy. The drug therapy is given as a primary treatment for patients with cancer for which an alternative treatment exists. Combination chemotherapy. That's administration of chemotherapy of 2 or more